So what we'll do, we'll now move into the question and answer portion of our meeting. We have about 30 minutes or so for Q&A. Just while you step over, I do have one quick question. With the guidebook that you just mentioned,
Yes.
Mustafa, when do you think it will be ready for distribution?
Well, what we are doing right now is we are collecting feedback. We had 2 feedback cycles. We collected feedback initially, and then there was some really good criticisms and some constructive feedback we got. We incorporated that. We went out in the community. Now it's collecting that feedback. Hopefully, I'm hoping by summer, if we can finalize that feedback, incorporate everything in there, then we would go into a translation phase to make sure that it's available in the different languages so that people can access it in their own native language. So I'll give you more descriptive or time as we get the feedbacks available to us. So it's still a work in progress.
Great, thank you. So we do have a first question from the room.
Yes, thank you so much for the presentation today. My name's Jody, and I work with the Surrey North Delta Division of Family Practice. My question is for you, Rasmeet. I'm wondering, is there any plans for updating, keeping the patient navigation attaching to a GP up to date? Is there, because I just, knowing how divisions are funded and some of the changes that happen, I'm wondering how that gets updated and we distribute that information to all the settlement services and other health community partners.
Thank you. So what we're doing is, in talking to the divisions and the clinics until now, we've kind of taken the final process as is in the communities. As it changes, I think, the settlement agencies could contact me, the divisions could contact me, and we don't have a timeline of how long it's going to be kept current until, but generally it should be a business as usual once the attachment nurse is gone, because these people are now Canadians, and how they access the system and find a GP should be as anybody else. If there's issues in that collaboration, talk to your agencies, like settlement agencies, and then you can get in touch with me and we can update it. Like if it's a huge difference, like I know Surrey North Delta might have something change soon. So yeah, that will be taken care of, but I don't know how it's going to be after 6 months. So, yeah.
My name is Janice Boots, and I'm representing a private sponsorship of a family that is from Syria, and they are living in Langley. My question is actually regarding the interim federal health. I'm kind of wondering about the transition from that into BC Medical. Is there anybody that can address kind of I guess what I'm wondering is, how long does the first program last? What does it cover? And then at what point do people get their care cards? Anybody know?
Do you want to talk to that effect, Mustafa? Do you have info?
I don't know specifically the timeline, so I would leave it to current. I used to know it, but not anymore.
I know a little bit about it. The interim federal health is for 1 year. And usually at about the 9-month, 10-month mark, you want to make sure that they start filling out their information for the MSP.
One problem that we had was Mummy. Sorry that this is so specific to our family. Mummy had a baby.
Yes.
And baby can't get coverage because Mummy's not on BC Medical.
Babies should automatically have it MSP because they were born at a Surrey hospital.
Yeah, it didn't happen. Or okay, so should have happened.
Yes.
Okay.
I don't know the details, and I think
Yeah.
the 1 year, I've heard the
Exactly.
1 year, and I've also seen somewhere there was an email that I saw, I don't know if it was a news release yet, but they were saying that IFH lasts for 1 year, but then you can apply for an MSP card even before, I think. So there was something to that effect that I saw somewhere. So we don't have the details, sorry, but there's links, so there's an IFH website, and it should have all the news releases and everything on it.
The privately sponsored is a little bit different.
Yeah.
If anybody does run into issues with getting MSP, is there a contact or someone you could suggest that they could follow up with I'm not
I
sure.
think not within Health Authority, but I think the best way is to contact Health Link BC. I think they may give you direct number to call. And they do have some language support that I know. I can't
They do.
remember. Yeah, they do have some language support, so if you don't speak English.
Yeah, and I think HealthLink BC is generally a good line for everything, because we were sitting and talking about these processes in a meeting, we just called and said, do you provide language services? If you just need information, they will provide you information on how you can go about in getting that kind of service. So that's a good resource.
And I just wanted to clarify in terms of that baby with the MSP, they get a number. Okay, but it's not activated or active, okay.
So we actually had to, like, for pediatric services, that will be reimbursed.
I know, but
Oh,
that's,
okay,
yeah, it's a difficult, it's a process to navigate. But that's good information, because, we were under the assumption at Public Health that baby has that coverage, right? Because they have a number, right? But then again, for us at Public Health, we don't turn anyone away. We're not dependent upon MSP or the IFH, right? We
For
kind of
most of our
go around,
services,
yeah.
Especially immunizations. So even people visiting qualify for immunizations?
Are there any other questions in the room at all?
My name is Maher Khalil. I am working with Success Organization as a settlement practitioner and a Swiss worker with the School District 42. Actually, my experience with Syrian refugee for the last year, I found many of them looking for female family doctors and female staff for all health issues, because sometimes women, they don't like to speak to male doctors about them health cases. So there is any plan to find some new position for females doctors or female other specialists like X-ray and other health programs?
I don't know if there's a program for that, but I think that's something that the divisions or any of the information that's on those process maps, for example, the division, the clinic, and between these guys, it's a collaboration within the community. So if you search for a physician, let's say at a College of Physicians website, there's a choice for you to say, find me a female. If there is a female doctor accepting patients, then yes, that will come up. If not, I think contact the division and just say, this is the case, what can we do? There is nothing, I don't know if there's anything within Fraser Health to do, anything about it, but.
I think within Fraser Health, the diversity part of the accommodation is if a patient comes in and asks for a specific gender doctor or a healthcare provider, they will try to accommodate as long as there's one on their staff available to meet at the time they're showing up. For example, if you show up at an ED, Surrey Memorial Emergency Room, and the ED for the night or for the shift is a male, unless you are able to wait for the next shift to come or something along those lines, they wouldn't be able to call in just for you at that moment. However, they would always welcome a comment saying, I prefer this, and that's part of accommodation. But I also want to reiterate that one thing also we do about education is to ensure and assure actually patients that regardless of whoever the gender that's providing service to them, that all doctors and healthcare providers will provide the best care that's available to them that is in line and respectful of their traditions and beliefs.
So I think to add to that, I will say some of the communities do have a primary care clinic, and then there's nurse practitioners there who provide service. So I think if that's the case, then it's also a good idea to call the clinic and say, this person is looking for that kind of services. There's 2 new Canadian clinics. There's one in Surrey, and then there's one in Burnaby. If call them, they will probably, and they should accommodate if there is an availability.
Okay, thank you. Actually, second question to Mr. Ahmed about interpreting. Are you accept only certified interpreters or specific certificate from these persons, or some patient they can ask family member or any volunteers person come to do this interpreting.
So the first part of the question is regarding the qualification of interpreters. Fraser doesn't do any recruitment, dispatch, or hiring of interpreters at all. We provide funding to PLS to take care of that. We are assured that all interpreters we're getting are professional. That means they are fluent in English and the target language, that they have some sort of experience doing interpretation in the past, and that they do meet some standards with regard to the Code of Ethics. That's the first part.
So they not need the certificate?
Not to my knowledge. There's no certification required, but there is the experience required. That is the first part. And the second part was regarding
family members or
family
any
members.
person to be volunteer to do this interpreting.
We have no objections to having a family member interpret for a loved one. We do understand that in some of the interactions, it can be there for emotional support or other support services, but we do have one objection. If there is a conflict of interest, for example, a husband interpreting for a wife where there is a suspicion of a violence, or there may be gender-based violence, something along those lines, you may be asked to step out and bring in a professional interpreter. Or if you realize that the family or the friend doing the interpretation is not even good at English, we may ask, because of the fluency level, we may ask a professional interpreter to step in to just ensure that the communication is accurate and all that. However, there is nothing that bans a family or a friend doing interpretation. We prefer professional interpretation to just make sure that the quality of interpretation and communication is accurate, and that we have the best care available to the patient.
So if the English level is good, anybody can do this interpreting?
Anybody can apply. I don't know about the hiring process, yes.
And
Anybody
people, they can apply to Fraser Health to do this interpreting?
You have to go through PLS.
Sorry?
PLS.
PLS.
Or other agencies who provide services. So there are a lot of interpreter service available. So that is the research for the person who wants the job.
And PLS is Provincial Language Service.
Yes, sorry.
There's
Thank
a lot
you
of
very much.
acronyms in this sector. So,
Thank you.
did anyone else want to respond on the panel, or nope? Did we get any questions online yet, or no? Okay, so next one in the room.
This is Jody again from the Surrey North Delta Division of Family Practice. Mustafa, I just wanted to add on, for our division, we've made services available for all the family doctors, so they're also able to access PLS in their office. So people that are looking for a family doctor in Surrey or North Delta do have access to interpreter services on the phone with their family doctor.
And this is only phone?
It's only
even
phone
one.
interpreter, yeah.
Yeah, and I think this varies across the region, but it is worth following up with the Division of Family Practice in your community to find out if there is any interpretation services covered.
Yes, like Jennifer pointed out, there's only limited number of divisions that are currently funding it because as it is quite expensive. But we are advocating to the provincial government to hopefully make it accessible for all physicians. From the division's perspective, I think it's important that all physicians can access that service so they're able to communicate with their patients.
Good.
I think if one of the GPs does not know about it, I think it's worth mentioning to them, check with your division if the division has that service available for them.
Okay, thank you. My name is Jean Dedier. My question will be for Jean. My name is Jean, so it's hard to say. You're Jean, right? For females, right. Jean. Okay. My question is during the public health definitions you gave in the third definition, the role to identify social determinant of health. So I was wondering, like, if you can give us some example of social determinants of health, and that would be one. The second is health promotion. How do you do your health promotion? You only promote to people who come to you, or you actually do outreach to the organizations that provide services to newcomers and give some training for them to to pass over, I must say, to to their clients. And the third will be in health protection. So health protection, you mentioned smoking and baby seat cars.
Yes.
Do you provide baby seat cars to your clients or to the organization who helps newcomers?
Okay. So I'll answer that one first just because it's fresh right in my brain. So for the protection, yes. So I mean, we have the Quit Now program, right, which is a provincial program in terms of smoking. But you were asking about the car seats. Unfortunately, we don't provide the car seats, though as nurses, we're quite resourceful in that if we have a family that is in real need, we do work amongst ourselves to try and locate that item. Or if we have to, we pool different resources and find ways to be able to purchase that item for them in that respect. But you can appreciate that we can't unfortunately provide car seats for everybody,
Yeah.
right? And then, but there are different programs like Baby Go Around, but unfortunately the car seat is one of those things that they do not provide. Just because in terms of, because lots of people want to give used car seats and you can't use when you go to purchase one, it's really difficult purchasing a secondhand one in terms of insurance wise. If you're going to be using it in your vehicle and stuff like that, it won't be covered. So you need to purchase a brand new car seat in that respect. So
Yeah, I understand then, because when you say health protection and you mention smoking, I understand you tell people stop smoking, but when you mention car seat, then I get confused. Do you provide car
I see.
seat, or
Okay.
why
It's more
is it
about
car seat in there?
information.
Okay,
So you
thank you.
provide information about car seat, right?
Yeah, and we can even, BCAA has clinics, so we'll help people once they do find their car seat and making sure it's safe and it's in the car properly and that they know that they exist and the ages and for booster seats and things like that. So we're more about giving information on and how and where to get that information.
Okay.
good question, thank you.
Yeah.
For us to clarify that, right? And it helps me too when doing this kind of presentation, right? So, the first question was to do with the social determinants of
correct.
health.
Just some of the samples of
And
it,
so,
'cause we are not,
I don't know if you're familiar with the Maslow's hierarchy of needs, right?
Yeah,
Are you familiar with
I'm
that?
familiar. I'm just speaking in the
You're
behalf of
busy in
everyone.
general, okay. So,
Because
yeah, those
sometimes
social-
you don't ask, someone will be happy that somebody asked the question when you don't. I am familiar, but I believe that's maybe some people not in the public health might not
Yeah, no,
understand what
absolutely.
social determinants of health means.
So the social determinants of health are like housing, education, gender, and being a part of those different things determines, sometimes your outcome in terms of your health.
So your overall vulnerability. So the more vulnerabilities you have, the more that we would tend to maybe follow with those families. There was one more question too.
Yes.
Health promotion.
Yeah, health
Health
promotion.
promotion. So how do we
Yeah,
do that? I
you
mean, I think
promote
it's.
to those who came, or you go to the agents who provide services and provide information that they would pass over to their clients who who were not able to come to the clinic.
Yeah, you answered it in both respects. We do all of that. So we're doing health promotion when people come to us in terms of our different clinics that we offer, right? In terms of giving them the information, right? Of whether it be evidence-based or best recommendation in terms of that health information. But when I think of health promotion, I think of a big component of that is going into our schools and then providing, whether it be from information on immunizations or certain children might have certain health diseases or ailments or restrictions, right? We have nurses that can come in and give those families specific education and information on what they're having to navigate in terms of their child's health, right, at school, right, and help them put into place the different parameters and stuff like that to help them, have the best healthy outcome, or, set that up.
The other
Thank
thing
you.
we're doing is we're going out to community agencies like First Steps in Umoja. We have a nurse that is assigned to those places, and she'll often do teaching for small groups, or she may do teaching to the staff around what our services are. So sort of attached to both the people in the workers in the different agencies and also the clients that they see.
Right, and then I was speaking to that one program in terms of our nutrition and stuff like that, so that's that Live 5210, right? But it's also a part of another program that we have that was piloted, but now is gonna be kind of rolled out to all of our health units and through the Healthy Living, and that's Avenues of Change. And that's a program that was just in West Guildford and targeting 2 schools and school-aged health children and their families, and the different things that they need in terms of, promoting health within their family and lifestyle.
Yeah, actually, that's a very good program.
Yeah.
I'll think about it, like Swiss worker, how do we access those information? Because it would be nice even to pass over those little 5210.
Yes, and it
Really
comes in different
great.
languages.
Yeah.
Absolutely. So that would be, your Swiss workers can access it, because there's a Swiss worker at Hawley or Jorth, and there is a school nurse that's attached to both of those. And she actually happens to be, I believe, one of the leads on the Avenues of Change program. And so she has that information that's now come into our health unit. I have copy, if you would like.
Sure,
I can give you
yes,
at least
please. Thank
to
you.
get you started, but we have lots of the copies of that messaging in our office that is available to be handed out.
Thank you.
Are
And
you-
it's in various languages as well.
Are you able to share that electronically so we can distribute it to everyone here today and to different service providers?
I would
I think so.
Yeah.
Perfect. Thank you. So we do have some questions from online.
This one comes from Chilliwack. What is currently being done to address the backlog that PAM Chilliwack, it's an acronym, PAM, is experiencing? Currently, PAM is only being provided when there is availability with care, and this is taking months.
Yeah, unfortunately, that's how it is with the division, and that's a division program to provide that service. So PAM is a patient attachment mechanism, and this is a hotline number that you can call and say, I'm looking for a GP. So that's how it is. There is a backlog. So I think everybody needs to understand. So if it's non-emergency, there's other, you can go walk-in clinics, you can call 811. If it's an emergency, 911 is your choice. Just make that call. Besides how the backlog is going to be handled, it's not Fraser Health. It's a division of family practice. So hopefully that answers the question.
And I know with the PAM, I believe it's in Chilliwack only, if I'm not
It's
mistaken.
Chilliwack only, yeah.
So,
Generally.
thanks. And to let everyone know, we're just about at the end of our session, so this will be the last question today, and we have about 2 minutes.
Okay, it'll be pretty quick. My name is Rima. I'm a settlement worker with ISS of BC in Langley. And I just have a question regarding the reproductive mental health initiative or piece that you guys mentioned. I'm just wondering if you can give us like a quick breakdown, like more of the details of what that entails, if we have time.
I don't know that I said it was an initiative. I
Oh,
just know
sorry.
that we work with reproductive mental health, and we have access to that in terms of with primary care or with the different birthing programs that are available. Wendy, do you know any more information?
Yeah, so it's something that we usually would try to screen moms to see if they would qualify for reproductive mental health, and it's really just a specialized type of mental health services. So we can't refer directly, the nurses, we refer to the doctor as a recommendation to for referral to reproductive mental health, but it's usually during that year or during pregnancy up to about a year after the babies are born.
Okay.
And I think a lot of these families qualify just from the trauma that they've been through. So if
Yeah.
you're seeing issues or problems, can always talk to one of the public health nurses who can do some screening, and then we can refer on to their GP, who would then make that decision.
Okay, perfect.
But
Thank
it's
you.
a wonderful program.
Okay.
Yeah.
Thank you.
And is it available throughout the Fraser Valley, or is
Reproductive
it
mental
primarily
health, yes.
Okay.
Yeah,
Great.
yeah. It's just hard, I think most of the services are through Surrey Memorial Hospital, as far as I know, but, so
Yeah.
sometimes it's hard to get to, but there are other mental health that can be accessed throughout Fraser Health. And Royal Columbian also has a portion of that as well.
Great,
Forget
thank
about
you. So before we get going, we just have a couple of minutes left. I did want to thank all the presenters today for taking the time to put this information together and to be here this morning and to share your knowledge and your expertise with us. So thank you very much.